Welcome, everyone. Welcome to our CPMH seminar series. We're quite excited today to have a number of people discussing our new postgraduate diploma in public mental health. So I think today's presentation is really exciting. It's going to be delivered by some of the core faculty here at the center. I wanted to introduce you to just a few of them before we get started. So first, I'm Katherine Sorsdahl. I'm the co-director of the center, which is a joint initiative between psychiatry here at UCT and Stellenbosch in the Department of Psychology. And I'll just hand you quickly over to Claire, so introduce yourself.
Hi everyone, I'm Claire van der Westhuizen. I'm on the UCT side at the Center for Public Mental Health.
And I see Ashraf Kagee is our co-director online. Ashraf.
Good morning, everybody. I'm Ashraf Kagee from the Department of Psychology at Stellenbosch University. Nice to be here.
Thanks, Ashraf. And Rizwana?
Hi everyone, I'm Rizwana Roomaney. I'm a lecturer in the psychology department at Stellenbosch University and also here from the Stellenbosch side.
Thanks. And there's also Shaheema is online with us too, a new addition to our team.
Morning, yes, I'm new, Shaheema Allie. I am lecturer at CPMH and I'll be the PGDip coordinator on the UCT and Stellenbosch side.
Wonderful. Welcome, everyone. So I'm just here to give you just a quick overview of what the presentation is going to be like today, and I'll end with some questions at the end. So do any comments or questions, do put it in the chat, and we'll answer them at the end. So just a brief overview of what we're going to be talking about today is I'm going to pass to Ashraf just now, and he's going to give you just a brief history of CPMH and really how it's come together. We're going to talk about our current postgraduate training, what we're already offering at the center, and why the rationale, why we need this PGDip in public mental health to really consolidate all of our postgraduate training. We're going to discuss a lot of the formative work. You know, we don't just do a PGDip. There's a lot of formative work that is involved as you move towards making this kind of course. We're also going to discuss the PGDip design and those sort of student-centered design concepts and learning concepts as we're incorporating it into our plan. Looking at PGDip curriculum and assessments, what a PGDip student, what a graduate will do potentially when they have a PGDip in public mental health, some of the applications, and of course our amazing faculty. I think although this is a collaboration with Stellenbosch University and UCT, one of the major things that make it special is that we have so many faculty from other parts of Africa that's really making this very coherent and strong public mental health PGDip. And at the end, we'll end with some questions. So I'm going to start by just passing over to Ashraf. So you'll be starting, and then all of our lecturers will be passing on as we go.
Okay. Good morning again. So Claire, do you want to flip the slide? So I'm going to talk a little bit about the history of the center, and the center was actually the brainchild, I guess, of two people, one of whom you see on the screen here. This is Professor Alan Fleischer, who unfortunately and very sadly passed away some years ago. The other person that was instrumental in conceptualizing the center was Professor Leslie Swartz, who is a colleague of mine at Stellenbosch University over here in South Africa. And we discovered, or rather Leslie and Alan actually realized the need to build mental health capacity in research and clinical work on the continent around the early or mid 2000s, when we received at Stellenbosch University many applications from people around the continent to join our clinical psychology master's program. And these were nurses and teachers and health administrators, even psychiatrists who wished to become clinical psychologists. But of course, we weren't able to consider the applications because they didn't have the undergraduate courses and curriculum in psychology to be considered for our clinical masters. What we did though, or rather Leslie and Alan had been speaking to each other about the need to build capacity, research capacity in terms of policy and other work on the continent in many African countries in the area of mental health. And the idea originally was to have a master's in philosophy in public mental health. In order to do that, we thought that establishing a center that would be jointly run by two universities, Stellenbosch University and the University of Cape Town, to put together the center in which people could come together and think through the challenges, the issues, the concerns about public mental health on the continent. And there were many people involved at the time. The main leaders were Leslie Swartz and Alan Flischer, but also Crick Lunt, Tony Naidu, who's in our department, and others like Arisha Benjamin, Sharon Kleinkies, and Lauren Miller, who were around at the time. Stellenbosch University actually made some funds available as seed funding to explore the idea of establishing a center and to put together the legal, institutional, bureaucratic, administrative mechanisms to make a center work to house a master's in public mental health. And so when the center was finally established, we had a memorandum of understanding, and we established a scientific committee and also an administrative committee to which the directors reported. And when the center was established, Alan was the main leader, but as I mentioned, he passed away, and so Crick Lunt became the director of the center. And we started taking in master's students in public mental health. The leadership of the center then went to Katherine Sorsdahl and myself, and we, I would say, established some very strong links, very important links in many countries around the continent. And it was, the program was supported in large part by the Amari funding from the Wellcome Trust. And then we started with the thinking through the issues related to what we need to ensure that students who entered the MPhil indeed graduated, and we put in place various mechanisms to ensure a success rate in the MPhil. Can I have the next slide, please? So the WHO Collaborating Center then, as the center was established, this occurred in 2014, and this was an important recognition that was accorded to the center because it meant that the center would now be a WHO Collaborating Center. I think I'd like the next slide, please. Yes. Okay, so we started recruiting students for the MPhil in public mental health, and the applicants came from a range of different sources and various disciplines. There were clinicians, there were people involved in teaching at university, there were health service managers and policymakers, and community organization workers. And so over the last several years, you can see there we've had large numbers of people graduating with the MPhil, and we currently have quite a strong cohort of students. And we also have a PhD program, a doctoral program for students who actually complete the MPhil or who come to us from other institutions where they have a master's degrees. You can see on the right side the different countries from which our students come. And just to a large extent, this program has been extremely successful, extremely helpful in building capacity on the continent in the area of public mental health. So I think I'm going to stop there.
Thanks, Ashraf. So I'm going to speak a bit about what led to the development of the PGDip and what the PGDip has to offer that is quite unique. So to start off, let's talk about why we're doing this PGDip. So even though, as Ashraf said, the PGDip is something that's always been planned, we've had several indicators over the years that let us know that it's something that is really needed. So first, through various CPMH collaborations and interactions with our master's and PhD students, we've become increasingly aware of the demand for formal training in public mental health. And this need has been expressed through different sort of people. So as Ashraf mentioned, we've got clinicians like psychologists, psychiatrists, nurses, and then also people who work in advocacy and those who provide informal and formal support to people facing mental health challenges. So that's our first reason. The second reason is that we receive many applicants for the MPhil degree, but around 20% of the applicants don't have the necessary qualifications that make them eligible to do the MPhil degree. And then finally, we find that many MPhil applicants often lack the knowledge and experience of research methods, and therefore they take more than 2 years to complete the MPhil. So it seems as though some are not ready to begin an MPhil. So what the PGDip can do is provide some sort of formal training for those working in the field of public mental health. And it can also act as a bridge for those wanting to enter further studies, such as several MPhil degrees that are available, or even master's degrees in counseling, clinical, or research psychology. Okay. So next slide, I'm going to talk a bit about what does the PGDip have to offer that is quite unique. So as a starter, it's the only diploma of its kind in Africa that we know about. And this course is important because it aims to address the gaps in public mental health research training on the continent. And as we know, public mental health takes a different approach to mental health, to mental health, like disciplines like psychology, because it takes a population-based approach. And so this diploma offers students the opportunity to learn about the impact of mental disorders on communities and how to prevent these disorders. And they also learn about mental health interventions and treatment that are aimed beyond just the individual. And we can see that in this case, a course like this is contextually relevant. And I'm going to hand over to Claire now, who's going to tell you a bit more about the grant and the course design process.
Thanks, Rizwana. Okay, so we then conceptualized Program Arise, which is the African Mental Health Researchers Inspired and Equipped program. And this was in order to address some of the gaps and opportunities that Rizwana has just spoken about. So initially, this was a D71 grant, which was funded by Fogarty International. And the overall aim of this project was to conduct formative work to inform the development of this PGDip. So I'm just going to run through some of the formative work that we conducted during this planning grant. So what we did was we interviewed African public mental health stakeholders and conducted a survey with past master's students. And here we're really trying to list information on the possible demand for PGDip, the desired impact of such a PGDip, and the existing training needs for people who we may consider as potential PGDip candidates. We also interviewed postgraduate course conveners, so current PGDips at South African universities, and we asked them just to give us some insights into the structure, content, and delivery of these programs. And we also interviewed colleagues at international universities about their global mental health programs. And we asked all these conveners about potential barriers and facilitators to developing and implementing our PGDip. And we really learned a lot of valuable lessons. And from there, we moved on to workshops where we developed an outline of the learning objectives and curriculum. And we also conducted a theory of change process. And this is just to elicit to really map out all the outcomes that we needed to reach the desired impact of our PGDip, as well as a monitoring and evaluation plan. Okay, so while we were busy with this work, we really thought we need to contextualize and think about where our PGDip does fit into the existing postgraduate training pipeline. So we conceptualized it like this. We thought that a PGDip graduate should really know a lot about the concepts and the skills and be able to perform some basic skills in public mental health. And then a master's graduate really needs to be able to take those concepts and skills and do the research and really get involved in either research or public mental health in a practical sense in the real world. And then a PhD graduate would then master some of these skills and concepts. So I'm quickly going to outline some of the findings from this work. So the qualitative research really confirmed our suspicion that there is a need for foundational training, for further postgraduate studies, and to lead to research and programs in the real world. And this would lead to a value for candidates as well as employers and communities. And the idea behind this as well is that we need a pipeline to masters or to future work. So we wanted our PGDip graduates to come out with something really concrete. So if people are interested in taking MPhil research forward, they'd come out with some sort of MPhil proposal, or other people might want to do an evidence review or a quality improvement project plan or something similar, which could really add value to their work and future careers. And also what came out of the finding is that we really need an understanding of evidence-based public mental health practice. So we thought that what we're going to do within our PGDip is we really want to give people an orientation to public mental health wherever they work, whether it be in research or as healthcare managers, policymakers, and community organizations. And we also want to instill in our PGDip graduates a culture of learning, that they will be equipped and inspired to address some of the knowledge gaps that we have in our settings. And we also would like our graduates to be able to conceptualize programs that would address mental health at a population level. And also during our research, there were a number of principles that emerged. So a focus on Africa definitely emerged, but not to exclusion of work from elsewhere. So the PGDip will still draw on work from the global north and south, and just exposure to diversity of knowledge and worldviews, as well as a diversity in the student group and lecturers. And so we think of this diversity when it comes to discipline and experience, as well as location. And also, as part of the PGDip, our plans are to introduce our students to experts in the field and develop a community of practice. Okay, so when it came to the curriculum, specific training needs were highlighted, particularly public mental health concepts and health systems, research methodology, implementation, and very much context-relevant issues, including culture. And then we also, from this work, we also got very, very helpful points on the delivery of a curriculum. And I'll talk a little bit about this just now. Right, so then what we did is we built on the work conducted during the one-year planning grant. And we now have a 5-year capacity building grant, also from Fogarty International, to strengthen and extend the postgraduate pipeline in African public mental health. So the first objective is this PGDip. There are also other objectives as part of this project. So we've got master's and doctoral students with NRIs as well. And we also want to strengthen the online teaching and mentoring skills and postgraduate student supervision within an African network of institutions, as well as deliver and evaluate short courses in implementation and policy research. But we're focusing on the PGDip in this seminar. Okay, so now we've done all this work and we have this grant. And now the challenge is to how do we inspire and equip our colleagues in Africa to work in public mental health and bring public mental health into their work. So now we had to bring together the people and the passion that we have, the principles that emerged during our formative work, as well as the package, the content and the skills that we identified. And we also really want to make this PGDip accessible, inclusive and engaging, very relevant to our students' contexts. And also I'm really excited to draw out students' knowledge and their own interests, and that we can then help guide them in their endeavors. And this will also enrich the field in general, and definitely us from our side as well as lecturers and faculty. So this is a very exciting journey, and we're extremely lucky to have people from the Centre for Innovation and Learning and Teaching at GCT, Nadine Hammond and Andrew Deacon, who've been amazing at helping us on this journey, and I have committed to help us bring this to fruition. So they've really been introducing us to learning design and tools that we haven't used before, and this is quite exciting. One of the most interesting or different tools for us was developing a personas. So the faculty got together and thought about, it's an imaginary person, someone who we think could represent
one of the PGDip candidates, and this is based on faculty's knowledge of the context and of our MPhil applicant pool. So we really look at this person from what their background is, personal background, what their strengths are, their educational background, and what kind of learning support needs they would have. So this is really helpful as we keep in mind as we design the program. So we use these personas in thinking about how would this student experience a PGDip in public mental health. So we really think we're designing for Abigail, or we're designing for some of the other personas that we've created. And something else at the SIL team, for me, it was one of the interesting things the SIL team's introduced us to, is thinking about how students learn. So moving away from just a list of topics and skills that we want them to know and be able to do, to how they learn. So thinking about not just learning acquisition, where students would just sit and look at a video or read something, but also to incorporate activities such as discussion, production, where they produce a blog, investigate, where they may go and administer a screening tool to someone in their family or community, collaboration and practice. So we've really found this extremely useful in thinking through the delivery of our course. Okay, so delivery. We're not just going to be online video conferencing. I think when a lot of us had to move to emergency remote teaching, a lot of Zoom happened. So there will be video conferencing within the course, but a lot of the lectures will be 10 to 15 minute videos, which can be watched. Mostly it'll be an asynchronous method of delivery, so students can download and watch at any time. We'll use things like blogs, and we'll do critical review of evidence and studies. We might ask students to present their findings of these reviews or other aspects of their learning. There will be some synchronous discussions and other activities, and this 25% of the course will be synchronous, either face-to-face with a small orientation block at the beginning of the course, or online synchronous discussions. And we also could do activities such as online writing, and we're really going to try hard to make sure that we're very available to our students with online office hours. And then we'll use interactive online tools such as Mentimeter and Padlet, which is really great for lecturers to be able to see, to measure our students grasping the concepts, and also for students to interact with each other as well. We also have practical workshops for skills, and also informal engagement. It's really important for us to keep in mind that we're trying to develop a cohort in the community of practice. So this is something we did in one of the MPhil classes, where we spoke about our favorite childhood memories, and we put it together on the class website, just as something that the class had done together. And also very important, just the personal touch of introducing our lecturers and just thinking about some of the things that our lecturers enjoy on a personal level about working in mental health. So those are a few aspects of the delivery. And I'm going to hand back to Rizwana, who's then going to talk us through the 4 courses within the PGDip program. Rizwana, are you able to describe the courses?
Sorry, I didn't unmute. Okay, let me start again then. Thanks for that. So I'm going to briefly introduce you to the courses on offer in the PGDip to give you an idea of what to expect. And the diploma consists of 4 courses, and students complete 1 course per term over the course of a year. And the year starts off in the first term with an introduction to public mental health, where students learn about key concepts in public mental health, such as the treatment gap, social determinants of mental health, health systems, health promotion, and a lot more. And this course really forms the foundation of the diploma. Students are then introduced to mental health epidemiology in the second term. And this is a basic introductory course to epidemiology, specifically for people in public mental health. And they learn basic concepts in epi and research designs and measurement. And then in the third term, students learn more about research methods. They learn theory and they learn about qualitative, quantitative, and mixed methods research. And this includes several aspects such as data collection and data analysis. This course helps to prepare students with enough knowledge about research methods to enable them to competently conduct a research project. And the diploma concludes with the course on interventions for mental health, and this is in the fourth term. And in this course, students will learn more about interventions, and the focus will be on public health interventions, health systems interventions, and the MRC framework for complex interventions. And if we look at these courses, we can see that this is a unique combination of courses that can be valuable to anyone who's wanting to learn more about public mental health. Next slide, please. Okay, so the courses will be supplemented with training that's aimed at building broader skills. So academic skills like academic writing and critical thinking will be developed with dedicated workshops and training throughout the year. We also think that it's important to develop students holistically, and the course will build on skills that are necessary in a professional setting, such as presentation skills, teamwork, and leadership. But we also want to emphasize personal development, and we're going to offer students also opportunities to learn things like self-care and time management. So those are the broad range of skills that we'll be working on with students throughout the diploma. And I'm now going to hand over to Shaheema, who's going to tell us what a PGDip in public mental health graduate looks like. Shaheema?
Thanks, Rizwana. I think it's the next slide. So when somebody graduates from this diploma, people always ask, what do we gain from it? So overall, when a graduate completes this diploma in 1 year, they'll be able to discuss the public health concepts using African concepts and ideas and looking at it specifically around that. They will also plan advocacy role. They'll be able to advocate for public mental health services for all, so equity, access for all, and try and overcome some of those barriers in discussing with various organizations and health systems. They'll also be able to create a learning culture within organizations or health systems by monitoring and evaluating what those systems look like. And then in the workplace setting, graduates will have the knowledge and skills to also advocate for implementing evidence-based informed public mental health policies and interventions at national, district, and community level. They'll also be able to look at it from a scientist practitioner perspective and have these discussions open within the workplace in order to gain that overall impact of advocacy and implementing evidence-based approaches. And this helps with a learning culture, so learning from what they can teach or kind of share with people in the workplace. And on an individual level, what I love most about this PGDip is that it does give the person confidence to apply and complete an MPhil and possibly go on to doing a PhD. They'll be able to communicate and use the language and on an overview of what public mental health looks like and what the field explores, and also to be able to critically engage and critique also what the data shows out there, as well as to be able to identify some gaps. They will also be able to develop an answerable research question, and this is another aspect that I quite like about this. So they'll be able to understand research methodology, design basic quantitative, qualitative studies to address some of these gaps, and also be able to communicate professionally and feel confident about it as well. Okay, the next slide for me. I think I just got the applications. The due date is the 31st of August, so the end of this month is the closing date, and you have to meet the criteria in order to make the application, and you need a basic bachelor's degree or an equivalent 3-year qualification in a health or development related field. You will be able to download the application, complete it, and the application is quite lengthy, so you just need to ensure that you complete it comprehensively, and it will look at this paper-based application, which must be sent to Sangilwa. You'll have to attach a photograph, signed declarations, referees, and you also have to complete or submit a piece of your own writing. I will put the link for this application in the chat, and then you can have a look at the application form. So all the completed forms go to Sangilwa. There's the email address. There are 9 fellowships available on the RISE project for the PGDip to candidates from African countries. So just remember, the closing date is the 31st of August. I would encourage you to have a look at the application and forward it on to anybody that you think this might be relevant to. Okay, I think we're back to Katherine now.
Thanks, Shaheema. I'm actually going to talk quickly. I just want to acknowledge our amazing faculty. Thanks, Shaheema, for all that information. All right, so we've introduced the core team at the top of the slide at the beginning of the seminar. And this is Nadine Hammond and Andrew Deacon just below us, and they've really been amazing and very patient with us and taught us such a lot already. So we're excited to continue this journey with them. And then I just also want to acknowledge all our collaborators from Ghana, Malawi, Nigeria, South Africa, and Zimbabwe. And there's some of us were able to get together earlier this year to brainstorm various ideas and to talk about the courses and really put things together. It was a whole lot of fun. I think we were working with sticky notes and putting them on walls and moving them around and really planning it out. So it was really great working with them. And now we're carrying on our work mostly remotely. But I just want to say thank you to everyone who's been involved and all your input so far. And I look forward to developing this further with all of you. So that's our team. And now we'd like to open up the floor for some discussion and questions. So you can either pop things in the chat or you can just speak up.
Thank you so much, Claire, and everyone. It really is so nice just to see all what's happening and how we really have some amazing public mental health specialists on the African continent that are and African continents that are really focusing on making this very unique. So can I open the floor to any questions? Nothing from the audience or in the chat. Thanks, Emma, for your question. I think at the moment we're just starting quite small. In terms of, I think we're going to have six to start. And the idea is that we want to use it as an iterative approach and just make it and improve it over time. So we're not going to be taking any self-funded students potentially for the first bits. And as we move forward, we'll take many more, as much as we can take. Did I answer your question? And the requirements for South African, sorry, you should also come in here, for non-South African candidates, for international candidates.
Thanks, Thokozile. Yeah, we don't have a limitation on the numbers of people from other African countries. This really is an African PGDip. So we just require that people have some sort of undergraduate degree that would prepare them to take on this PGDip. But yeah, and we generally ask the people that their education is kind of in a related discipline. So health, social sciences, we have made it really broad. And there's something else about if anyone qualifies for the fellowships. The fellowships are the same. I think currently our requirements for the PGDip and the fellowships, we don't have any extra requirements for the fellowship. So really undergraduate degree in appropriate discipline. It'd be great if you had some sort of experience in the field. We're really hoping for students to share their experiences with each other and with us. That's going to be one of the very exciting aspects of the course, I think. The fee, initially we're not, obviously a PGDip does usually have a certain course fee attached, but because in the first couple of years we're only offering fellowships, that the course fees are not really applicable for the first few years. For the first 4 years, we'll be taking fellowship candidates. So there will be no course fee applicable for those candidates.
And maybe just to mention in terms of study visas, because you won't necessarily have to be based in Cape Town or Stellenbosch to do the PGDip, student visas wouldn't be necessary. So it's very similar to our MPhil program, where our students don't necessarily have to have student visas to do the MPhil.
Thanks, Kat. And at the beginning of the PGDip, we would like to gather people in Cape Town for 2 weeks, just to orientate everybody and get to know each other. I think if anybody did have some limitations or issues in attending the course in Cape Town, then they must just email us and we can discuss further.
Great. Any other questions? Oops, I think I missed one going above. We have Miriam. What is the current footprint of public mental health application on the continents? Miriam, do you mean more in terms of research or capacity building? If you're able to answer that. And maybe I could answer in terms of that was your more of a research question. I think we are seeing a massive increase in public mental health specialists on the continent. Zimbabwe, Dixon Shaband is one of the main ones that's really taking public mental health forward. We have many in Nigeria and Kenya. And I think it's really about creating a sort of a community, a public mental health or global mental health community, where we can really learn from each other and not redo everything over and over and over, but really learn from each other's experience and take this whole global public mental health movement forward. And we're hoping that the PGDip and the MPhil and us at the center will allow us to do that and really kind of speed it along, knowing what we know about that very large treatment gap.
And I think just thinking about the interest we've had in the past and currently, we do get people asking, people who are working as healthcare managers, who are working in ministries of health, and mental health is a part of their job, and they feel like they need to upskill and gain some knowledge. So people would be able to use that knowledge in that sort of area. People in community organizations. We've also had interest from a teacher and who's very interested in mental health within schools. So, and also we generally have for the MPhil as well, there's a number of clinicians who would really like to bring a public mental health perspective to their clinical work as well. So public mental health is really can be applicable to a range of contexts.
And I see there was a few questions about tuition fees. And I think I have to recall, Shaheema might know a bit better in terms of the fees. I think that last year there for another PGDip was about 35,000 Rand. So presumably it will be in that kind of ballpark, if that answers your question. It does change and go up and down, but I think that's what it was for last year's similar PGDip.
Yeah, I think we've got
5,000 plus. So yeah, it's around there.
Thanks, Shaheema. We've got Norma Mashani online who said that the personal self-development aspect really helped her. We worked some of that into our MPhil as well. And Norma is also now one of our RISE PhD fellows, which we're very excited about. Yes, this program is approved by SAQA, which is the South African Qualifications Assurance Board or something. I don't have it exactly, but yes, we have approvals at national level for the program from Stellenbosch side and UCT.
Oh, so in terms of capacity, Miriam, for expanding public mental health, I think what's been really, really nice over the years is there's been a number of large international grants that really allowed the opportunity for fellowships and more supervision. So it was a firm in the early days. Prime was the original one, and Amari 1 had 46, I think, PhD students and postdoc fellows all over the continent. And there's Amari 2 coming as well with this Fogarty grant. And I think one of the main issues for sort of capacity building from a student point of view is sometimes a lack of supervisors. And I think what we're really seeing is over the years, there's many more supervisors in all of these continents than previously. So we're able to expand a bit more rapidly, but it does take time because you do need good quality supervision, and it's quite constant and supportive supervision to get through the PGDip, but also the MPhil and a PhD to really build that capacity. What is the retired time capacity for a candidate in terms of weekly lectures? I'm working full-time to want to check that. Don't know if one of my other colleagues wants to answer that, Rizwana or Ashraf?
Sorry, can you repeat the question, please?
What is the required time capacity for a candidate in terms of weekly lectures? I'm working full-time, so I want to check that.
So we try to design this program so that it can be accessed by people who are currently in full-time employment, and we try to make it such that the number of hours that are required would not be overly onerous. We're completely aware of the fact that people have full-time jobs and may have families and other commitments as well. And so a lot of this learning will occur asynchronously. Some of it will be synchronous, but others, a lot of it will be asynchronous. So people can actually access the materials and proceed through the program at their own pace. There are, of course, requirements that need to be met and requirements that need to be implemented. But essentially, it is a program that is friendly to people who are currently in full-time employment.
Thanks so much, Ashraf. I think that's also in line with our MPhil program in a way, because that also is sort of part. You can still work full-time and do your MPhil, which I think is quite important given the target we're looking at is often, clinicians or other people who are already in careers and just want to kind of apply their knowledge and move forward. So that's quite important, I think, for us in our postgraduate training program generally. Great. Any other questions or concerns for our team?
Can I make one observation, if I may, Kat?
Yeah.
And this is the fact that this program and the MPhil, the PGDip, and the center in various ways tie in with the strategic development goals of the United Nations, particularly goal number 3, which is to ensure healthy lives and promote well-being for all at all ages. And so we very much think of ourselves as wishing to make a continental footprint and wanting to be part of a debate and discussion about health and mental health as it pertains to the continent and the world.
Thanks for that, Ashraf. I think it is really, really important. I think that's also why public mental health is getting so much traction, I suppose, because we have a lot of work to do as we move forward. Any other questions or comments? Great. I think we will stop there. I know everyone is quite busy. I really appreciate all the presenters. All the information is online and also on our website. Do please circulate if you think of anyone who may be wanting to apply. I think you said the cost of the course, I think we said there's fellowships, but it's about 30,000 rand. But just do take it online, do send some emails. There's some available people to respond to your emails if you are interested. And just to say, I think there was some concerns previously about having to write a full proposal for this PGDip. That is not for a research proposal, that is not required for the application. So it's really about having a motivation and desire to start your kind of journey in public mental health. So when you see the form, it's not that scary.
Yeah. We're going to share our screen again now. I'll just give you the website and some email addresses, and we'll just leave that up for a bit.
Great. Any last words from our presenters? Anyone want to add anything? Oh, good. Great. Thanks, everyone. I hope you enjoy your weekend, and we'll see you at our next seminar, which will be in 2 months' time.
Thanks, everyone. Bye.
Thank you. Bye-bye.
Thank you.
Thank you.